the University of California, San Francisco at Mission Bay, where top scientists seek causes and cures for disease. Now imagine a medical center next door, where discoveries made here result in better patient care. It's easy to imagine UCSF caregivers changing the world in a medical center like this. Just look what they do every day.
You? Did you win?
Yes.
Okay, one more time.
When George and Mia Boggs play yardball with their daughter Sydney, you notice Sydney gets way more hugs than hoops, and no wonder. When she was just 4 months pregnant, Mia Boggs learned her fetus had a tumor as big as it was. To save it, Mia's doctor in the East Bay recommended UCSF Children's Hospital and Michael Harrison. He pioneered fetal surgery, operating on fetuses while still in the womb.
I'd have to think about it to come up.
After consulting his team of 24 specialists, Dr. Harrison decided to operate before birth. He drained the tumor, removed it, and delivered baby girl Sydney safely.
Here she has all these tubes and lines hooked up to her, and I wanted to hold her. The nurses said there wouldn't be an issue. They just wrapped the blankets around her and, pass her to me, and it was great. I was able to hold my bundle of joy.
The fetal program could never have flourished without all the other things that contribute to the environment of a great university, hospital, and medical school like UCSF. It just can't be done elsewhere.
At the recently renamed UCSF Benioff Children's Hospital, extraordinary outcomes like this are standard because our discoveries produce better care.
So did you take an airplane to come today, McKenna?
It means oncologist Kate Mathey can offer the latest treatments because she leads many of the nationwide clinical trials. Diabetes caregiver Steve Gittleman can explain a promising new drug because he's one of the researchers testing it. In the newborn nursery, Michelle Cathcart can offer parents an easier MRI for their baby because UCSF developed one.
Oh, really? Oh, cool.
Does UCSF do the remarkable? Well, look at Sydney.
Thank you for coming.
Goodbye.
Bye.
My experience with UCSF has been phenomenal from day one, and without it, my life would be drastically different.
Actually, we're in a mock-up of an internet home.
Rick Justice is Executive VP at Cisco Systems, and he's a family man. Two good reasons why when he learned he had prostate cancer, Rick wanted the best. So he asked Michael Milken, who heads a prostate foundation, to suggest the best surgeon.
He gave me a list of just a few people, and right there on the top of that list was Peter Carroll.
The capsule, the prostate.
That's Peter Carroll, the surgeon and researcher at UCSF's Helen Diller Family Comprehensive Cancer Center. Rick's operation would remove the tumor but spare the nerves. It required incredible precision, microsurgery. Dr. Carroll succeeded, leaving Rick so impressed that years later, when traces of cancer reappeared, his decision was simple.
So I went back to Peter, of course, and he put me in touch with Joyce Spate over in the radiation oncology side of the house, and once again had a wonderful experience.
What's great here at UCSF is we have a stellar group of researchers, basic scientists working with great clinicians, and we put those two together to develop new treatments which we bring more rapidly to the bedside to improve outcomes.
The reason UCSF's cancer program is second to none is its combination of discoveries and treatments. Researchers like Tejal Desai are developing nano-drug delivery to track and destroy cancers down to a single cell.
There was a study.
Caregivers like Laura Esserman in the Breast Center can offer women a full range of treatments, plus 24 clinical trials. Everyone here, from the lab bench to the bedside, puts the patient first, and it works.
My situation required the best in prostate cancer, and that was at UCSF.
On UCSF's Mount Zion campus, the National Center of Excellence in Women's Health is transforming women's care. With better research to understand women's unique health needs and comprehensive care that respects women's preferences and the unique female biology. Women facing breast cancer get the full resources of UCSF's renowned cancer care program. For high-risk pregnancies, one of the world's leading teams of high-risk obstetricians and neonatologists. Specialized care for the years after menopause, and life-changing options for the 1 in 3 women suffering from fibroids, like Villy Wong.
Step into a circle if you feel like you can identify with something.
Villy runs a nonprofit engaging underserved youth in media production. But she was coping with fibroid tumors on her uterine walls so big she couldn't sleep on her stomach. Then she heard about the UCSF Comprehensive Fibroid Center, whose founder, Allison Jacoby, offers treatments many women don't know exist.
Yes, there are lots of choices, and unfortunately, I still see people coming in for consultations who have been told their only choice is a hysterectomy.
Empowered by her choices, Villy had Dr. Jacoby remove her fibroids without a hysterectomy.
I do love Dr. Jacoby to death. She is fantastic. I mean, she changed my life, so how could you not love somebody like that? It's such a relief to know that I have found my caregiver for life. No matter what happens to me, I know I will call UCSF.
The fibroid pioneer, the cancer specialist, the father of fetal surgery. These remarkable caregivers and their colleagues have established UCSF Medical Center as a birthplace of better health care. And that gives UCSF an historic opportunity. In less than 10 years, this field on the edge of downtown San Francisco has become UCSF at Mission Bay, where brilliant researchers use the genome, nanotechnology, and biopharmaceuticals in their quest for cures. Joining them now is the Helen Diller Family Cancer Research Building, and soon the Centers for Cardiovascular Research and Neuroscience. But the larger goal was always to speed this Mission Bay research to the patient bedside. And so, on this lot across the street, UCSF plans to build a world-class medical center, housing 3 hospitals for women, children, and cancer. The new medical center will be on the edge of downtown San Francisco, accessible by the 3rd Street rail line on one side and Interstate 280 on the other. Medical Center CEO Mark Larrett.
Imagine how our patients are going to benefit here at UCSF when we can take the results of the research in these buildings, one of the most spectacular research campuses in the country, and apply it to the medical care of the children, women, and cancer patients directly across the street. We believe that's the unique opportunity that we have here at UCSF.
And co-locating these 3 hospitals at Mission Bay will spark another sort of collaboration among the hospitals themselves.
There's a great synergy of having children's with the cancer hospital, because so many of the children in our hospital have cancer, and the link with the women's hospital is a natural. So when women deliver babies, we want to treat both the woman and that new child.
UCSF Benioff Children's Hospital will have its own child-friendly entrance, and patient rooms will have more space for visiting families. The Cancer Hospital will have expanded bed capacity, and the adjacent Women's Hospital will offer cancer care, specialty surgery, a birth center, and more. And their location, directly across from UCSF's research campus, will speed the translation of discoveries into better treatments. Campaign Chair Dee Dee Wilsey says these research buildings will offer
proof to anyone in that hospital that we're working on cures, that there are people there who are up late at night. You're in the hospital, you can see the lights, you know somebody cares. They're not going to give up.
This project also benefits UCSF's Parnassus and Mount Zion campuses by freeing up space for essential medical services that remain there. We have an extraordinary, once-in-a-lifetime opportunity. We have the people and programs to advance health worldwide, but we need your help to build a world-class medical center capable of unlocking their potential. The UCSF Medical Center at Mission Bay will require extraordinary community support. Your support. Join us.